Cervical cancer is a type of cancer that occurs in the cells of the cervix. The cervix is the lower, narrow part of the uterus that connects to the vagina. Cervical cancer is a serious health concern for women worldwide. However, it is largely preventable with regular screenings and vaccination. This type of cancer develops slowly, often over several years. It typically starts in the cells lining the cervix, known as precancerous cells. If left undetected and untreated, these precancerous cells can develop into cancer. Cervical cancer is primarily caused by the human papillomavirus, or HPV. HPV is a common sexually transmitted infection. There are many different types of HPV, and some types are more likely to cause cervical cancer than others. Understanding cervical cancer, its causes and risk factors, is crucial for prevention and early detection. Regular checkups and open communication with your healthcare provider are essential for women's health. Early-stage cervical cancer often presents no symptoms, highlighting the importance of regular screenings. As the disease progresses, women may experience various symptoms. These symptoms should not be ignored and warrant immediate medical attention. Abnormal vaginal bleeding is a common symptom. This can include bleeding between periods, after sex, or after menopause. Increased vaginal discharge is another warning sign. The discharge may be watery, bloody, or foul-smelling. Pain during intercourse is a red flag. Pain in the pelvic area, including the lower back, is also common. If you experience any of these symptoms, it is essential to consult a healthcare professional promptly. Remember, early detection is key to successful treatment. Don't hesitate to seek medical advice if you experience any unusual symptoms. Diagnosing cervical cancer involves a multi-step process. The first step is a pelvic exam, where the doctor visually and physically examines the cervix. If any abnormalities are detected, further tests are necessary. A Pap smear is a crucial screening test. It involves collecting cells from the cervix to examine for abnormalities. This test helps detect precancerous cells and early-stage cancer. If the PAP smear shows abnormal cells, a colposcopy may be recommended. This procedure allows the doctor to closely examine the cervix using a special instrument. During a colposcopy, a biopsy may be taken for further examination under a microscope. A biopsy helps determine the presence and extent of cancerous cells. This information is crucial for staging the cancer and planning the appropriate treatment. Section 4. Treatment options, a beacon of hope. Treatment for cervical cancer depends on several factors, including the stage of the cancer, the patient's overall health, and, well, their preferences. Surgery, radiation therapy, and chemotherapy are the primary treatment options. Surgery may involve removing the cancerous tissue, or in some cases, the entire cervix. Radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy uses drugs to destroy cancer cells throughout the body. Often, a combination of these treatments is used to achieve the best possible outcome. Advances in cancer treatment have significantly improved survival rates for cervical cancer. With early detection and appropriate treatment, many women go on to live long and healthy lives. It's essential to discuss all treatment options and their potential side effects with your healthcare provider. Section 5. Prevention and early detection, your greatest defense. Prevention and early detection are paramount in the fight against cervical cancer. Vaccination against HPV is a crucial preventive measure. The HPV vaccine protects against the types of HPV that are most likely to cause cervical cancer. Regular PAP smears are essential for early detection. These screenings can detect precancerous cells before they develop into cancer. It is recommended that women start getting regular Pap smears at age 21. Adopting a healthy lifestyle can also reduce the risk of cervical cancer. This includes quitting smoking, practicing safe sex, and maintaining a healthy weight. Remember, knowledge is power. By understanding cervical cancer, getting regular screenings, and taking preventive measures, women can significantly reduce their risk. Talk to your doctor about your risk factors and what you can do to protect yourself.